Is it bad to squeeze your breast during pregnancy? Are you unsure if it's bad to squeeze your breasts during pregnancy? Don't panic, though, you will feed your baby soon enough, and it is very normal to have a small amount of discharge oozing from your nipples. The discharge is nutrient-rich colostrum, which is distinct from regular breast milk in terms of texture and color. Squeezing it out and storing it for the upcoming baby is acceptable. We will delve deeper into this subject and share with you all the various information on colostrum. What is a colostrum? Colostrum is sometimes called liquid gold. Pregnant women typically experience nipple leaking during the second trimester, early stages of pregnancy, and late pregnancy. This leak does not contain typical breast milk. Colostrum, a gooey, yellow material that resembles glue, is what it is. This has a higher concentration of nutrients than breast milk, making it even better. It has white blood cells and is good for the baby's stomach. What does colostrum contain? Breast milk is the tastiest and healthiest newborn nourishment, according to doctors. In terms of nutrients and long-term advantages for both the mother and the infant, no formula milk even comes close to it. Colostrum, on the other hand, is even more beneficial than breast milk, according to studies. Its composition is the cause, and the main components are mentioned below. Vitamins and antibodies. Multiple antibodies found in colostrum strengthen the infant's immune system. The multivitamin content of colostrum makes it one of the most significant sources of vitamin A for the developing newborn. It's no secret that vitamin A is good for a baby's organs and eyes. The vitamin B complex is also widely distributed along with vitamin A. Protein. In addition to vitamins, colostrum is a protein-rich food that boosts a baby's body growth and offers its tissues the fortitude to maintain and repair cells. Regular protein cannot be provided to younger babies in the beginning since it is not digested by them. Fortunately, the proteins in colostrum may be digested and supplied to the infant to help him or her gain strength. Minerals. Colostrum also contains minerals that the body cannot create on its own, like zinc and calcium. They are essential nutrients for healthy body development. They are readily available for the baby in the form of colostrum because they cannot be obtained by the newborn from any other supplement. These elements support healthy bone and heart development. Benefits of squeezing your breasts during pregnancy. Squeezing your breasts when pregnant might be advantageous in several ways. It may assist in boosting blood flow to the area, encourage milk production, as well as soothe some pregnancy-related discomforts. The following are the top 3 advantages of clenching your breasts during pregnancy. Stimulate production of milk. Your baby's need for milk will grow as it gets older. By gently rubbing and squeezing your breasts, you can encourage your milk production and help meet this demand. Additionally, it may help to avoid engorgement in the future. Increase blood flow to the area. You can also aid in increasing blood flow to the area by lightly massaging and squeezing your breasts. It can assist in maintaining the health of your breasts and in minimizing some of the potential pregnancy-related discomforts. Relieve some of the discomforts. Engorgement, blocked ducts, and mastitis is some of the discomforts that might accompany pregnancy. Some of these discomforts might be eased by gently massaging and squeezing your breasts. Should I collect colostrum that is leaking? You can, indeed. The expressing colostrum technique makes it simple to collect colostrum and express colostrum. Colostrum can be expressed simply by gently stimulating the nipples with clean palms. To collect as much colostrum as you can place a jar over your nipple. Breast milk production can also be induced by nipple stimulation. Why do I get clear liquid coming out of breast when squeezed in early pregnancy? Colostrum, a clear liquid that comes out of your breast when you squeeze it, is produced by your body for your precious baby starting in the first trimester. Expressing colostrum early is a good sign, and it can be stored in a tight and dry container. This is caused by the prolactin hormone, which will start to rise in anticipation of your due date and is in charge of creating milk for your baby. Nipple stimulation is typically advised by doctors and midwives for most mothers as a technique to encourage their bodies to go into labor naturally and prevent the need for any interventions. Nipple stimulation triggers the production of oxytocin, popularly known as the love hormone, an incredible hormone that also encourages your body to start contracting, squeezing colostrum, causing your cervix to open, induce labor, and kicking off your labor. Colostrum after birth. Within the first 6 hours after birth, new moms are recommended to latch their babies on for nursing. This is not required because breastfeeding will eventually result in milk production. As long as you carefully latch the infant to your breasts and massage your breasts, the baby's natural urge to suck will typically be adequate to produce enough milk. After birth, colostrum is quickly secreted. Simply use the proper technique. Sit slanted with your back properly supported. Do not extend your nipple region when you cup your breast and lay your thumb on one side. Now, lightly press your nipples with your finger while circling them around them for stimulation. The colostrum will squeeze out for you to see. Is it bad to squeeze your breast during pregnancy? You should exercise caution because it is well known that nipple stimulation can help to naturally induce labor, which raises questions about this. Early colostrum expression during pregnancy is not necessary unless your doctor advises it. If there are signs that the baby may need special care, your doctor may advise extracting colostrum that is already flowing and saving it to feed to your baby once they are born. If a woman has leaking breasts prior to birth and has gestational diabetes or diabetes before conception, she is advised to express milk. The cause is that newborns typically have low blood sugar and risk developing hypoglycemia if untreated. The baby may experience severe consequences from hypoglycemia. What causes leaking breasts? Hormones are the primary culprit. Your body is getting ready to have a baby. Some medical disorders, certain drugs, nipple stimulation from a bra, and sexual activity are possible additional causes. There may be no avoiding medical reasons. You can talk to your doctor if you notice you are significantly leaking. For leaky breasts, the correct bra can make all the difference. Use organic materials like cotton, and stay away from wearing lace so close to your nipples. A seam running down the middle of the bra should be avoided because it can itch. Should I express colostrum before birth, so I have a supply for baby? You don't need to gather milk in advance because your body can create it very quickly. However, you can start collecting beyond 39 weeks if there are no risk factors and you'd like a little supply in case of a C-section. Can expression or pumping cause labor? Yes, it is the answer. This is particularly true if your pregnancy is high risk, you are 40 weeks or older, or you are having cramps after expressing. If you are past due, this can be an excellent way to start labor, but it is recommended to avoid it before 39 weeks. Is it bad to express colostrum while pregnant? When expressing colostrum during pregnancy, there are potential hazards. If you are experiencing a high-risk pregnancy or regularly expressing a lot of milk, the hazards are higher. Early labor can be brought on by colostrum expression or breast stimulation. It is preferable to avoid this unneeded risk if you are prone to early labor, multiple births, or other medical conditions. Premature labor cannot result from leaking breasts. How to express and store. If your doctor gives the go-ahead for you to squeeze colostrum prior to delivery, try to avoid using a breast pump and instead use hand expression to obtain the colostrum. By beginning to squeeze your nipples and areolas with the opposite hand, you can manually express breast milk and obtain a few drops that can be collected into a teaspoon and then kept in a dry, airtight container. Depending on how long you plan to preserve it, the container must then be sealed and kept in the freezer or refrigerator. although hand-expressing colostrum requires some practice. What are the benefits of colostrum to your baby? Your breast milk will be necessary as your baby gets bigger and stronger every day. If you want to breastfeed your child, he will probably take in 1 teaspoon of colostrum every day on average. And this amount is plenty to feed his tiny body and enable him to reach his developmental goals. The advantages of colostrum for your newborn are as follows. Deeper sleep. Colostrum will be required in little doses to fill your baby up and help them sleep longer. The baby develops physically and psychologically healthier when they get enough sleep. Offers vitamin A. Eye and organ health is preserved by vitamin A. Decreases jaundice risk. The risk of jaundice, or the yellowing of the skin, in your newborn is reduced by maintaining the health of organs like the liver. Boosts immune system. Because colostrum contains antibodies that aid in the development of a robust immune system, you may be certain that you won't need to visit the doctor often. Take food rich in essential vitamins for healthy eyesight. Lots of protein. Despite its modest quantity, colostrum has a high level of protein. This promotes the growth and repair of tissue. Organic laxative. Additionally, colostrum is a potent laxative. Wrapping up. In this article, we have discussed colostrum, a liquid gold which is a nutritious substance that is good for a newborn baby. We have also discussed, is it bad to squeeze your breast during pregnancy? Do give this article to know more about how the breasts produce colostrum. If you like this video, make sure to give it a thumbs up, and also subscribe to my channel for more informative videos like this one.